Healthcare professionals have urged the government to strengthen health systems and integration of rehabilitation across the healthcare system. They made the remarks during the USAID Learning, Acting and Building for Rehabilitation Health Systems engagement meeting with the members of Parliament on the Health Committee to forge a way and evolve health system to meet the growing needs for rehabilitation and assistive technology.
To increase the human resources in terms of rehabilitation, to increase the financing for rehabilitation in our healthcare system, especially at the primary healthcare level. You find a full hospital can have only one or two rehabilitation professionals, maybe sometimes even ill-equipped to be able to handle the conditions that come over. So you want the rehabilitation to be strengthened across the healthcare system.
Before the budgeting cycle. So we pledge that we shall try as much as possible to put some money aside to national medical stores for procurement of some of these devices.
The second area itself is in terms of the tax regimes. A lot of these assistive devices are very, very costly. Some of the hearing aids go as high as 3 million Uganda shillings. And part of this high cost is because of the taxes that are charged on them. When you look at medicines, there are no taxes that are charged on them. But these devices, some of them have tax implications on them, which is hindering access. So it's an area that we want to strongly look into to ensure that access to these devices is improved by.
Some of the health professionals from different fields expressed the urgency of the integration of rehabilitation healthcare systems and also include assistive technology as part of essential medicines.
I request Parliament to help my chairman to see that the Minister of Health endorses the private practice for technology so that we can regulate these devices. You go to Katwe, everyone is producing wheelchairs. Okay? Those things need people who understand them, the measurements and everything, their technicalities. You get to my point? Then the other thing is these people who import, we have NGOs, they are very good, we appreciate. But some of them are just dumping these things into our country. Okay? Artificial hands, which are no longer even functional, some of them are not functional. They take them to northern Uganda, West Nile, where they don't come to Kampala, they fear because people will know. They're just dumping them. Okay? Then you ask yourself, who is analyzing the quality of these assistive devices?
That members of Parliament from here, when we are reviewing the next budget, we look into the 18% that was put on Pampers. My daughter uses 5 Pampers a day because she cannot go to school without Pampers. And then we are seeing 18% on adult diapers. How are we going to support our children to go to school? All these are things that we are using to support our children, to rehabilitate them in their lifetime. So these are the things, ladies and gentlemen, that we would like you to really, you put on our shoes in a way. And before any tax, any regulation is passed, we do some really concrete consultations, what exactly is needed, because I can no longer now afford the 18% tax on the Pampers, because I used to use 50,000 a week. Right now I need 80,000 per week.
The USAID Learning, Acting and Building for Rehabilitation in Health Systems promotes routine engagement with all the rehabilitation stakeholders, actors in the country to promote efforts geared towards strengthening and integration of rehabilitation across the healthcare system. Zahara Awigaba, UBC News.